Good day, ladies and gentlemen. My name is Sidharth Nambiar. I'm a medical student from Flinders University who's working with FBW Gynaecology on this process. Today, I'd like to thank the AGES Symposium for giving me this opportunity. This brings me to the topic of discussion, percutaneous tibial nerve stimulation, or PTNS. What is PTNS? To put it simply, bladder function is regulated by the sacral nerve plexus, and the tibial nerve shares the same nerve root as the nerve supply of the bladder. So in this treatment, we stimulate the tibial nerve to indirectly neuromodulate the bladder. PTNS is indicated in patients who have overactive bladder, urinary urge incontinence, non-obstructive voiding dysfunction, and fecal incontinence. On the flip side, it is contraindicated in patients who have a pacemaker, implantable defibrillator, nerve damage that might impact their tibial nerve or their pelvic floor function, patients who are prone to excessive bleeding, and women who are pregnant or planning to become pregnant during the course of the treatment. So what are the advantages and disadvantages of PTNS? One of the biggest advantages is that it has been shown to improve symptoms of overactive bladder by almost 60 to 80%. It's a non-surgical and low-risk option. It's a non-medical treatment with no known side effects, so it can be arranged to be part of a multidisciplinary team management plan. On the other hand, symptoms improvements can take up to 8 weeks to be visible. Each session takes about 30 minutes, and it's a weekly commitment. So it can only be done in an outpatient setting, and that means there's limited access in a public hospital. And finally, the multiple item rule with Medicare does complicate things a little. So this brings us to our study. This diagram shows you the structure the patient followed. We divided it into 3 phases. The induction phase was the patient having 12 sessions of PTNS over the course of 3 months, or 1 per week. The aim of this phase was to achieve 50% improvement in their symptoms. At the end of this phase, they had a consultation with the gynecologist to assess their progress. And only if the gynecologist felt that they had adequate improvement in their symptoms did they move on to the next phase. Following this, they entered the tapering phase, which was 5 sessions in 3 months, or 1 per fortnight. And the aim for this phase was to sustain the therapeutic benefit seen in the first one. Following this, they enter the maintenance therapy, where they have 1 session per month indefinitely to maintain the therapeutic benefit. The aim of our study was to assess the efficacy of PTNS treatment for the management of overactive bladder as a second-line treatment option. And the way we did it was using a prospective cohort study of patients who underwent PTNS. We started in October 2018 and are still going on. This was done in a gynecologist's private practice in Adelaide, and we used the Australian Pelvic Flow Questionnaire and the ICIQ OAB at baseline and after each phase to assess patient response. So this brings us to where we are today. We've had 166 patients finish phase 1, 51 finish phase 2, and 10 finish phase 3. For the benefit of time, today we'll be looking at results from phase 1 and phase 2. So based on the ICIQ, we looked at 4 major symptoms of overactive bladder, namely urinary urgency, urinary frequency, urinary urge incontinence, and nocturia. The first results we saw was for urinary frequency. The diagram here shows you the scoring system we used, where the patient scored their severity from 0 to 4, where 0 represented them having to go to the bathroom 1 to 6 times, while 4 represented them having to go to the bathroom 13 or more times. And as you can see from the results, there was a significant reduction in the symptom severity after phase 1. And interestingly, we also saw a significant reduction after that, after phase 2, which seems to indicate that the tapering period might have more therapeutic benefit than we initially anticipated. Following this, we looked at urinary urgency, and once again, we had a very similar system of scoring where the patient went from 0 to 4. 0 is them never having urgency, and 4 is them having urgency all the time. Once again, we saw significant reduction in their symptom severity after the first phase. Following this, the therapeutic benefit was maintained by the second phase, and this was exactly the goal for this phase. This brings us to nocturia. And once again, a system of 0 to 4, where 0 is them never having to get up at night, and 4 is them having to get up 4 or more times. Once again, we saw a significant improvement in their symptom severity after the first phase. If you look at the graph, there seems to be a slight reduction in their symptom severity after the second phase as well. However, this is not statistically significant. This brings us to urinary urge incontinence. And we use, again, a similar scoring system, 0 to 4. 0 is them never having urge incontinence, while 4 is them having it all the time. And once again, we saw significant improvement in their symptom severity, which was maintained after the tapering phase. So overall, this shows that PTNS was a fairly effective form of treatment in this cohort. So this brings us to the strengths and limitations of the study. This is the first study on PTNS in Australia with long-term follow-up. And the results we got with the symptom improvement for overactive bladder is consistent with the published data out there. On the other hand, we did have a slight issue with loss to follow-up, especially because of the COVID-19 restrictions. Because a large part of our cohort is above the age of 60, we were severely restricted, and because this procedure can only be performed in the clinic, we were severely restricted on who could come in and how we perform the procedure. You also have to consider the fact that it takes 30 minutes per procedure, so there could be some issues with compliance. Overall, PTNS appears to be a safe treatment for the overactive bladder disorder in this cohort. It improves symptoms of urinary urgency, frequency, urinary incontinence, and nocturia. On the other hand, there are still some questions about long-term compliance and treatment feasibility, just considering how much time it takes, how regularly you have to come in, and the cost. But overall, we think we got pretty positive results with this treatment. So that's all we have for today. Thank you so much for your time.